I'm Dr. Natasha Beach and I'm a sports and exercise medicine consultant at Welbeck. I think in the world of sports medicine, where we obviously see elite athletes and we see amateurs, they are mostly noticing that it's shortness of breath that they're feeling. They may well have recovered from their COVID and feel back to their normal level, but the moment they start exercising, they realise that they're struggling a little bit. With anyone with COVID, my first piece of advice is do not return straight back into sport. Even if you're absolutely desperate to get back into activity, it's really important that you follow a return to sport pathway that gets you back into exercise gently. My second piece of advice is not to do that protocol until you are back to feeling totally normal at rest, just doing normal activities around the house. And then I think thirdly, I would recommend that if you're doing a pathway that's set out for you in terms of returning to activity, if you don't feel up to it, you shouldn't rush through. Everyone takes different lengths of time to get back to feeling normal, and some people are 3 weeks and other people are months. After patients have had COVID, the most obvious symptoms that we see are people with chest pain or shortness of breath. However, something that's not really being picked up on is the impact of time out for patients. So say you're someone who's really sporty, run all the time, then have a week to 4 or 5 months out with COVID, the risk is that when they go back into sport, they've lost that physical fitness and therefore are far more likely to develop an injury, such as going over on their ankle or rupturing a tendon or a calf muscle, for example. And that's something that we need to be really careful and aware of, and when we're encouraging patients back into activity when they've recovered. Long COVID is something that we're seeing a lot of at the moment, but we don't know whether it's something that will be around for years to come. We would hope that those who've had COVID recover quickly, but we are aware of those who've developed COVID in the first wave and have still got symptoms a year down the line. Ideally, we would like those patients to recover fully and go back to normal life, but we won't know for years to come whether that's the case or not.